What do constantly cold feet and poor memory have in common? One possibility is thick blood. Many have heard this non-medical term, but not everyone understands what it actually means. But thick blood is no metaphor. It's very real. It's the kind of blood that prevents your feet from warming up, your brain from thinking clearly, and most importantly, leads to blood clots. In older age, thick blood is common for most people. Does that mean blood clots threaten all of us? Let's find out. In this video, we'll reveal how to improve your blood health without pills, although we'll talk about medications too. You'll learn how to restore healthy blood thickness and eliminate clots using simple but effective methods. Today, you'll discover, why is aspirin dangerous? How do the Chinese get rid of clots? What do Tibetans use to thin their blood? What's wrong with bananas? How does water prevent ischemia? Which clot is more dangerous, red or white? Does rosehip thicken or thin the blood? What simple movement improves blood viscosity by 25%? Does everyone over 65 develop clots? And our expert and experienced surgeon will teach you how to protect yourself from thick blood and clots. But first, let's understand what thick blood really means. Doctors call it hypercoagulation. Now, imagine tomato juice. One glass has a lot of pulp and another has very little. Just like that, thick blood has more cells and proteins than normal. When blood composition changes, so does its viscosity. And even a school child knows, the thicker the blood, the harder it is for it to flow through the vessels to deliver oxygen and nutrients to the organs and tissues. Poor blood flow accelerates aging by 5 to 10 years. And every unit increase in viscosity raises your cardiovascular disease risk by 26%. To pump thick blood, the heart has to work 20 to 30% harder. It's like your heart is constantly carrying a backpack full of potatoes. And here's the key. Thick blood leads to blood clots. Let me show you how. Remember from biology class, red blood cells, erythrocytes, are oxygen couriers. In thick blood, there are too many couriers. They crowd together and not only get in each other's way, but also interfere with the repair crew, platelets, which stick to each other and vessel walls like magnets, forcing clumps. These clumps are clots, and a clot the size of a pinhead can block blood flow in a small vessel completely. A single drop of blood contains about 250 million platelets, nearly twice as many as there are stars in our galaxy. What does that mean? That each platelet is a potential clot, especially in thick blood. But are you sure thick blood should always be thinned? To do it correctly, you must understand how remedies or medications work. Take aspirin, for example. This well-known drug is prescribed by doctors to prevent clot formation. But how do you know it works? Aspirin acts like a security guard. It blocks an enzyme that's involved in platelet production. When you take aspirin, your platelets become less sticky and are less likely to form clots. In essence, aspirin helps thin the blood and prevent vessel blockage, potentially saving lives. But there's a catch. Aspirin can cause side effects like gastrointestinal bleeding, especially if taken long-term or in high doses. And yet many people believe that blood clots are inevitable in old age, so they take aspirin as a preventive measure. Our channel's expert is here to clarify this. Today, we're joined by Dr. Vadim Andreevich Sidorov. an experienced phlebotomist and surgeon to help us understand thick blood and dangerous clots. Some people mistakenly believe that thrombosis or thrombophlebitis is inevitable in old age. But everything depends on the balance between the blood's clotting and anticoagulation systems. That's why it's important to undergo an ultrasound examination of the lower limb veins, which will show whether there are signs of varicose veins or blood clots. Here's the point. For clots to form, 3 things must happen. Blood must flow slowly, the vessel walls must be damaged, and the blood must be overly prone to clotting. Only when all 3 factors come together does a clot form. But thick blood is already harmful on its own. Blood delivers oxygen and nutrients to all organs and tissues, removes waste, and defends us from disease. The condition of your blood affects the functioning of every system in your body: cardiovascular, immune, nervous, everything. So can you tell if your blood has become too thick? Only lab tests can give you a reliable answer. Usually, doctors order a D-dimer test. It shows the risk of thrombosis and a complete blood count to evaluate the condition of your blood. But if you frequently experience headaches, dizziness, fatigue, numbness in your hands and feet, or if you're always cold, there's a good chance your circulation is impaired due to thick blood. High blood pressure can also indicate high blood viscosity, although, of course, it may have other causes as well. Cold hands and feet, fatigue, and high blood pressure, these are symptoms nearly every older person is familiar with. So does that mean everyone develops thick blood with age? Unfortunately, yes. If young blood flows like a smooth liquid, older blood becomes more like jelly. So what do we do with all that jelly? We thin it out. And there are effective ways to do that. Watch till the end, we'll show you all of them. Right now, I'll tell you about a food that strengthens blood vessels. It grows in every garden, is sold in every store, and costs next to nothing. What do you think it is? Parsley, dill, or green onions? The correct answer is dill. It contains special compounds, flavonoids, that help strengthen vessel walls. The stronger your vessels, the less they get damaged, and the lower your risk of blood clots. So can we somehow protect ourselves from thick blood and clots? Maybe we should get regular blood tests and ultrasounds. The most important thing is to consult a specialist. A phlebotomist or a cardiovascular surgeon can help assess the condition of the veins in your legs. But each vessel, whether a vein, superficial or deep, is simply a tube that carries blood. The risk of developing thrombosis or thrombophlebitis primarily depends on the condition of the blood itself. You know what really protects you? Caring about your health. Let's be honest. Many of us don't think about health until something hurts. And the older we get, the less we move. But prolonged sitting slows blood flow in the legs by 50%. By the way, regular physical activity reduces blood viscosity by 15 to 20%, which adds 5 to 10 years to your life. And who doesn't want to live longer? Write in the comments right now. Would you like to live to 100? Or at least to 90? I know I would. Famous Russian cardiac surgeon Leo Bokharia once said that the first habit for good health is a positive attitude in life. A good mood affects your physical health, and even your blood thickness, believe it or not. How's that possible? I'll explain. And soon, our expert will name the most dangerous food for your blood and tell you how to help dissolve clots. If you've been following our channel, You already know that when you're stressed, your body releases stress hormones, and these hormones increase blood clotting. Just think about this. Chronic stress increases the number of platelets in your blood by 12 to 15%. So what, you might say? Everyone gets stressed. Not everyone ends up in the ICU with blood clots. That's true. But can you be sure you'll be one of the lucky ones who won't? Let's find out just in case. How can you tell if a clot has formed? Is it something you feel right away? Or can clots live in your body without symptoms? Thrombosis or thrombophlebitis can affect either superficial or deep veins, and the symptoms will differ. It's important to understand that veins don't hurt, even when inflamed. When thrombosis or thrombophlebitis occurs, the pain usually affects the tissue surrounding the vein. In some people, thrombosis may have no symptoms at all, but in cases involving superficial veins, symptoms may include localized pain, skin redness, and increasing swelling in the leg. This kind of pain and swelling won't go away on its own. If the redness and pain are so intense that you can't even touch the inflamed area, you should urgently see a phlebologist and undergo a duplex vein scan. If leg swelling is the only symptom of thrombosis, it typically doesn't go away overnight and usually occurs in just one leg. How can we get rid of clots? All treatment for clots is aimed at stopping clot growth and speeding up the breakdown of existing clots in the veins. The simplest and most effective thing you can do is to start eating foods that reduce clotting and thin the blood. Experts have long compiled a list of foods known to thin the blood. These foods should be on your plate every day. What does healthy blood need? Omega-3 fatty acids. Where do you get them? From flaxseed oil. Just 1 tablespoon a day reduces blood viscosity by 15%. Omega-3s are also found in fatty fish, like herring or mackerel. Eating fatty fish twice a week can improve blood flow by 20%. This kind of food also lowers bad cholesterol, another big plus for your health. What else should you eat? Don't forget about turmeric, a favorite of over 1 billion Indian households. It's rightly called the spice of joy or the spice of life. Curcumin reduces the risk of clot formation by 25% because it improves blood vessel condition and reduces inflammation. Now, pay attention. This is important. If you're taking blood-thinning medications prescribed by a doctor, avoid grapefruit juice. Why? Grapefruit contains substances that block enzymes in the liver. These enzymes are responsible for processing blood-thinning medications, so grapefruit can interfere with how your meds work. What else should or shouldn't you eat? Let's ask our expert if there's a food they believe helps keep blood from becoming too thick. There are people who frequently visit doctors and those who proudly say they've never needed one. The latter group often refuses prescribed medications and believes that traditional remedies and nutrition can cure everything. In my opinion, that can significantly thin the blood in cases of actual clotting disorders. Our ancestors used various herbs for this, but modern medicine offers far more effective treatment options. Well, evidence-based medicine is clear. Food loses to medication. But we're considering all possible ways to help the body. So right now, I'll tell you what foods should be removed from your diet. When dealing with thrombosis, grapes, raisins, chocolate, and bananas are off the menu. But why? What's wrong with bananas? We found that besides their high carbohydrate content, which alone isn't great for blood vessels, all these foods are rich in potassium, which is essential for maintaining fluid balance and regulating blood pressure, but excess potassium can increase blood viscosity, exactly what we want to avoid with thrombosis. Of course, we can't claim that food alone determines blood thickness, but our diet does affect blood composition. That's a fact. Want better blood flow? Avoid these foods: Brussels sprouts, arugula, broccoli, spinach, and parsley. They contain vitamin K, which helps prevent bleeding, but in excess, it can create problems. Take potatoes and rice off your plate. They're full of starch, which turns into sugar in your body. That raises blood glucose levels and increases blood viscosity. Eliminate alcohol and smoking. Most doctors consider them poisons for the circulatory system, even in small amounts. There are no safe doses. We've discussed this in detail in our video about liver health. Go watch it. There's a lot of useful information. And if alcohol is poison, then water is medicine. Believe it or not, ordinary drinking water helps prevent ischemia. In one study of about 20,000 men and women, those who drank at least 5 glasses of water a day had significantly fewer fatal cases of ischemic heart disease. Even mild hydration, with just a 1 to 2% fluid loss, increases blood viscosity by 2 to 3%. Look here. In healthy blood, water makes up about 50 to 60% of its total volume. For good vascular health, it's recommended to drink 30 milliliters of water per kilogram of body weight daily. That's about 2 liters for someone weighing 70 kilograms. You can also support the body by adding natural blood thinning remedies to your clean water and balanced diet. Now let's talk about natural ways to thin the blood. Let's start with lemon water on an empty stomach. It's been proven that regular intake can reduce the risk of blood clots by 15 to 20%, as vitamin C improves blood vessel elasticity. Just squeeze half a lemon into a glass of warm water and drink it first thing in the morning. In Tibet, they also use lemon to improve circulation. They mix the juice of 1 lemon, a glass of rinsed oats, and 2 tablespoons of honey. In the evening, it's all soaked in a liter of warm water. In the morning, strain the mixture, you'll get about half a glass, and drink it 30 minutes before breakfast. Tibetan drink is believed to regulate cholesterol and boost liver function, which is essential for healthy blood. The liver filters about 1 liter per minute. Now it's time to talk about herbs that help prevent thrombosis. But be careful. Always consult a medical professional before taking any herbs or supplements for blood thinning. Even mild herbs can interact with your medication and cause harm. Ginkgo biloba is an ancient plant known to improve circulation and strengthen blood vessels. It's also used in herbal medicine to help thin the blood. We talked about it in our video on dementia. Check it out. Licorice root is also known for its anticoagulant properties. It helps prevent clot formation and supports cardiovascular health. Motherwort is another great herb. It calms the nerves and improves blood flow, reducing the risk of blood clots. Now, about rosehip tea, which many see as a natural alternative to vitamin C supplements. Some say it thins the blood. Others say it thickens it. So, where's the truth? We found that rosehip tea or decoction made from the fruit helps thin the blood. That's why it's often recommended for varicose veins. But a decoction made from dried rosehip roots has the opposite effect. It thickens the blood. So, If you want to support circulation and get your vitamin C, skip the roots and stick to berry tea. Take 25 whole washed berries and pour 1 liter of boiling water over them. Start with small doses and gradually increase. Watch how your body responds and adjust as needed. Even natural remedies can have side effects. Another great drink, ginger tea with turmeric. Grate a 1 centimeter piece of fresh ginger and add 1/4 teaspoon of turmeric to a cup of boiling water. Let it steep and enjoy it like tea. But avoid sweet clover, melilot. While it contains coumarin, which can prevent clotting, high doses of it can be toxic. Forget melilot. Let's return to traditional Chinese blood-strengthening methods. Turns out, maintaining healthy blood requires effort. And since many of you asked for more on Chinese medicine, let me share how the Chinese keep their blood healthy. In traditional Chinese medicine, or TCM, the life force qi is closely connected with blood. In ancient texts, blood is called the mother of qi, emphasizing their strong link. Qi is believed to renew every 24 hours and guide the movement of blood. And yes, you can stimulate this energy and your circulation along with it. Here are 2 Chinese self-massage techniques that improve blood flow by 25 to 30% with daily practice. Technique 1. Combing. Gently stroke your skin from limbs toward your heart, as if combing it lightly. Technique 2. Tapping. Softly tap large muscle areas with your fingertips. Too skeptical for that? Try a classic, the windmill exercise. Standing, swing your straight arms forward and backward, gradually increasing range. Do this for 1 to 2 minutes, 3 to 4 times a day. Another simple exercise, march in place, lifting your knees high. High knees help the blood move better. March for 30 seconds. Rest for 30 seconds. Repeat 3 to 5 times. Here's one more. Try it right now. It oxygenates your blood. Inhale deeply through your nose for 4 counts. Hold for 4. And exhale slowly through your mouth for 6 counts. Do 5 to 10 cycles, 2 to 3 times daily. This breathing technique can boost your blood's oxygen level by 5 to 7%. How? Deep breathing increases lung volume, helping you absorb more oxygen. Holding your breath allows more gas exchange, and slow exhalation removes more carbon dioxide. Simple. If it only were that simple to find a doctor who truly understands blood clots and how to prevent them in older adults. How can you tell if a doctor is good? Our expert shares some tips. This is a very complex issue. A key factor in choosing the right doctor is the trust established between the patient and the physician, which only develops through personal interaction. Of course, if a patient is assigned to a clinic, they may not have a wide choice of doctors, but private medicine is always an option. If you need a second opinion, you should look for another doctor. The internet can help. Reviews and articles about doctors are easy to find. Of course, this isn't a perfect solution, because many skilled specialists don't have an online presence. So use all available methods and trust your instincts. If you're not satisfied with the doctors you've seen, keep searching. It's your health after all. And which specialist should you look for? Who handles blood thinning issues? A general practitioner or cardiologist won't be able to properly assess blood clotting disorders. In such cases, you need to see a hematologist. A hematologist can evaluate your test results, identify what's wrong, and determine how to treat it. A phlebotomist may also help in some cases, but the key is to seek timely medical attention and avoid self-treatment. How many doctors did you see before finding your doctor? Or are you still looking? Tell us in the comments and leave your questions for our experts. Now, let's summarize everything into 3 golden rules for living without clots. Here they are. 1. Say no to smoking, alcohol, and unhealthy food. 2. Drink enough water. 3. Exercise regularly, at least 30 minutes a day. Try to fit at least 30 minutes of physical activity into your daily routine. Walking, yoga, weights, biking, anything you enjoy. Hike mountains, run on a treadmill. Just move. Physical activity is necessary even if a person is elderly or has difficulty walking. If someone has joint issues, they can swim in a pool. For other leg problems, cycling may be suitable. I have many older patients who live in villages and only get around on bicycles during the summer. Some of them are 85 years old. Without physical activity, the muscle pump in the legs stops working properly, which leads to swelling. Physical activity in old age also helps to train the heart. You must stay active, even if you've had heart attacks or have left ventricular hypertrophy. Remember, health isn't just the absence of disease, but an active life, balanced diet, and self-care. That's all for today. Subscribe to our channel and give this video a like if you found it helpful. Your likes inspire us to create more valuable content. Share your progress in the comments and let's support each other. See you next time, and may every day be full of energy and joy. Wishing you health and longevity.